seems easier nowadays to make a doctor's appointment and check medical records online, right? But Tiffany, you've learned there are barriers still that are out there.
Yeah, and I think it's some things that a lot of us take for granted. Oftentimes, it depends on where you live. Access to quality health care is something most of us probably take for granted, right? Let's take our outlying communities, for example. According to Rural Health Information Hub, some of the barriers include distance and transportation, workforce shortages, and being uninsured or underinsured. Recently, I traveled to Geneva and Conneaut in Ashtabula County to learn more about the ways hospitals are trying to overcome these challenges.
It was April 9th.
There are days
I had coughing really bad and wheezing in my chest.
you never forget.
I never experienced nothing like that before. So I thought I better get to emergency room.
That are life-changing. For Anita Housel, it was a Tuesday morning with an ER doctor.
I was tested for COVID, wasn't pneumonia. He said it was bronchitis. And then they said they found a mass on my right breast. And he said it was breast cancer.
It was emotional.
You just feel like shocked that it's cancer. And then, of course, I cried. And then the first thing you think of when you hear cancer is death.
Breast cancer, stage 2, but curable. Now, every Tuesday, she gets chemo treatments. And believe it or not, she actually enjoys going.
They make it comfortable as possible, and they're my friends.
This is University Hospital's Seidman Cancer Center, not in downtown Cleveland, but about 70 miles east in Conneaut, Ashtabula County. While the hospital has been here for years, that well-known name associated with this cancer treatment space is new this spring.
One thing about the smaller hospitals is that we all got to buckle down and help each other out the best we can.
Dr. Kevin Andrick is the chief medical officer for UH in Conneaut, and down the road where I met up with him at UH in Geneva. He says while the population is growing in rural communities like these, getting physicians to follow suit is challenging.
We do have physicians that grew up out here and they want to come back, which is great, and we're very blessed when that does happen, but it doesn't happen too often.
According to the 2021 Ohio Rural Health Improvement Plan, people who live in rural and Appalachian counties often don't believe there are adequate health services in their neighborhoods. They also tend to travel farther and for longer to get health care. Plus, people who live in these areas are slightly more likely to go to the ER for issues a regular doctor could treat.
As an ER physician, I'll take care of patients in the ER and they'll come to the ED just to be transported downtown because they don't have a ride to get there. That's pretty often, believe it or not.
Anita is grateful she doesn't have to travel far for her cancer care.
Because there are side effects they said to watch out for. They said get to the emergency room, boom, I'm here.
You talked about that first day getting that diagnosis and thinking of death. What do you think now, all these days later?
That I can be saved. I put in God's.
She says she puts it in God's hands and she believes that she can be saved. So what's happening to help with the physician shortages in these areas specifically? UH is working with the state to recruit international doctors, but it's a long process. Dr. Andrick tells me they are looking to get more physicians next year. When it comes to transportation, a local ambulance company is able to provide shuttle services to patients, but you have to call ahead of time. And really going into this new cancer treatment center there in this hospital, it's newly named Seidman, but they've made some renovations, and now these patients have access to specialized care, which Anita, of course, is grateful for. Not only is she dealing with her breast cancer diagnosis years ago, her husband and her daughter were diagnosed with colon cancer. So, the family knows the struggle.
You really don't know how much you need it until you need it.
Exactly.
Yeah.
Yeah. Good thing it's there, right, and close for her.